hurdles do patients face when accessing quality overall myeloma care? And what can be done to get over these obstacles?
The biggest problem for me is that because myeloma care changes so fast, which is a good thing, that we have all these options and we have so many new therapies, it's really hard for people who don't do just myeloma to keep up. I don't think I would be able to. I don't do breast cancer. I don't do other treatment, other cancers. So when I take my boards every 10 years, I have to learn a lot to take those. So it's just a part of the system, right? That this is the problem. And so I think, if you're seeing a local oncologist that sees 5 myeloma patients a year, they're going to be stuck on what was the treatment, when they did it last time for that last patient, which again, might be very different now because things change so fast. And so again, you want to get to, a doctor quickly. And I understand that when people hear cancer, like, I got to get treatment, I got to go fast. Right. But, part of it is, yes, if you need treatment quickly to get to your doctor, but then try to make a second opinion appointment done, even virtually, right? Because we can do that now after COVID. We have so many more options for that. And get that second opinion just to say, is this the right therapy for me? Going forward, what should I do? So patients, should I get a stem cell transplant if you're newly diagnosed or not? What kind of maintenance should I be doing? Do I have high risk disease or not? What are the nuances of my myeloma versus, everybody else that we need to be careful about? Should we dose reduce? There's a lot of those types of hurdles that patients, if they have kidney failure from their myeloma, we should be decreasing the dose of some of the medications, those types of things that really we can help with to make sure those outcomes are the best. And that first treatment really does matter so that we can reverse as much as possible for patients who have kidney involvement versus bone involvement, right? To decrease the pain really quickly. Do we need to get our radiation doctors involved to get radiation to help make sure you don't get a fracture from a potential bone lesion? So I think, again, I understand the urgency of seeing somebody, getting diagnosed and starting therapy, but quickly get to a second opinion so that they can help. And then again, some of these patient advocacy groups are amazing for myeloma. And I think, there's just so much information there that you don't want to get overwhelmed, but at the same time, you want to start going a little bit at a time at those things so that you can learn more about what you need to be asking and doing.